Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking to Dr. William Hart of Hart Cosmetic and Reconstructive Surgery in St. Louis. As a triple board certified plastic surgeon, Dr. Hart holds board certifications in plastic surgery, facial plastic surgery, ear, nose, throat, and microvascular and hand surgery. Dr. Hart offers a variety of cosmetic procedures ranging from breast augmentations, tummy tucks, rhinoplasty, and facelifts. Welcome, Dr. Hart.
Thank you, Mike. Good to be here.
Dr. Hart, please tell our viewers a little bit about yourself and your practice in St. Louis.
Well, I've been in practice here in St. Louis for about 20 to 25 years. I do a mixed volume of different cosmetic procedures, as you mentioned, from facial cosmetic procedures, including facelifts, eyelids, noses. I also do tummy tucks, mommy makeovers, body sculpting, liposuction, and cosmetic breast surgery, breast reductions, breast lifts, breast augmentations.
Well, today we'd like to ask you some questions about breast augmentations. So maybe you could share with our viewers who would be a good candidate for breast augmentation.
Good candidate for breast augmentation is somebody who has a limited amount of breast development and who has either had that since puberty or has developed it through childbearing and wants restoration or creation of more volume and has realistic expectations.
So if someone was looking for a surgeon to perform a breast augmentation, how should a patient actually select a surgeon to do the procedure?
I think it's always worthwhile to seek out maybe one or two or perhaps even three surgeons, have them evaluate you, go by and interview them, have somebody that you're comfortable with, and then see some of their previous work, either that's posted on the internet or else that they have in their office that they can show you, and make sure you're comfortable with the surgeon and that his explanation for treating your problem is consistent with what you're trying to achieve.
So what you had said previously is breast augmentation is generally for enlarging a breast?
Yes, it
so
is.
What types of procedures are available for enlarging a woman's breast?
Well, there's several different approaches and several different implants that can be used. The most common approaches are probably the inframammary incision, where the incision line is made at the crease line beneath the breast. The other common approach is the periareolar incision, where the incision is made somewhere between 3 and 9 o'clock at the junction with the pigmented layer in the normal skin, or else the axillary incision. Those are your incisional approaches to putting in the implants. The implants can be placed behind the muscle, or the muscle and fascia, or they can be placed behind the breast tissue itself. Different types of implants that we have available now are different saline implants, where you have a silicone shell that's inflated with sterile IV fluid at the time of surgery. The other types are silicone-based implants, cohesive silicone gels, where the gel is very little chance of leakage, and even if it does leak, it's self-contained, it doesn't spread throughout the body. And there are also the silicone gels which have been present but modified greatly from the early 1990s and 80s. So those are your different approaches and your different implants.
Dr. Hart, I think one of the biggest concerns we've heard from our viewers is the amount of scarring that's involved. So which procedure minimizes scarring?
Of the different approaches, in my practice, I think the periareolar incision minimizes scarring the most. The incision is just at the pigmented layer in the normal skin. The skin of the areola is a thinner skin. Generally, the thinner the skin, the better the scar. It's camouflaged at that junction point there. The incision allows access to the space between the glandular tissue and the skin, where you can make a tunnel that goes down to the inframammary fold. Then you go back up behind the glandular tissue or behind the muscle. You're not diving straight through the breast tissue, so the risk of sensory problems with periareolar incision is no greater than it is with the axillary incision or the inframammary approach.
Can breast augmentation affect self-examination and or mammograms?
Well, it can affect self-examination, mainly because the implants are either placed behind the glandular tissue of the breast or they're placed behind the muscle, both of which push the glandular tissue out further and are not between patient's fingers and their breast tissue. As far as mammograms go, the statistic that's quoted is that breast implants placed above the muscle can obscure up to 22% of the breast tissue, whereas breast implants placed below the muscle can obscure up to 9% of the breast tissue. So generally speaking, behind the muscle leads to more safety as far as mammograms go. On the other hand, you can always take additional views to see more of the breast tissue if necessary.
And I know you said previously that breast augmentation is generally for someone who may have smaller breasts due to giving birth or just from puberty. So my question for you is, how is the optimum size determined for someone who wants to have their breasts enlarged?
Well, optimum size it depends on the size of the patient's chest, the amount of breast tissue, and the width of the breast tissue, as well as the height of the breast tissue. And this can be all measured at the time of the examination. That would give you the optimum implant size and shape. You would like to have the implant covered by the breast tissue so that the implant isn't wider or larger than the breast tissue. That's where you're going to have issues with palpability of the implant, mainly in the lateral and inferior aspects of the breast.
And I know you answered a little bit about the advantages of the placement in regards to self-examination and mammograms. So let me ask you a little bit more detail about that. What are the advantages of above the muscle placement or below the muscle placement?
Well, the advantage of above the muscle placement is there's shorter recovery time. It's not as uncomfortable as behind the muscle placement. The other advantage is in patients that have some laxity to the skin, you may get a better fill of the space where the implant's placed, meaning more fullness of the breast and less tendency for the breast tissue to maybe sag. Implants placed behind the muscle have the main advantage of they're massaged more, there's a little lower rate of firmness behind the muscle, and also there's less interference with mammograms.
Well, we've talked about women who are having their breasts enlarged for the first time, but now that this procedure's been around for a while, when should implants be replaced once somebody has the procedure?
Well, there's no set in stone time frame to have your breast implants replaced. Mainly the breast implants are they're not designed to be a lifetime product, but there's no set rule that they have to be replaced in so many years. Some people have the impression that your breast implants have to be replaced at 10 years. And the reason I think they got that impression was the warranty that the manufacturers supply for the breast implants covers replacement for the lifetime of the patient. If there's a problem with the implant, they will give you a new set of implants. In the first 10 years, they'll give about $1,200 towards any additional surgical charges. After 10 years, that additional $1,200 is not available anymore, so they would have to pay out of their own pocket. But to replace your implants, you're talking anywhere from probably $4,000 to $6,000 to replace them. For a $1,200 warranty, that's not going to make a lot of sense.
Sure, I understand. Well, let me ask you one last question. Could you kind of go through, for our viewers, what are the risks involved or what are the potential complications of having a breast augmentation?
Well, as with any surgical procedure, bleeding postoperatively, which is probably less than 1% to 2%, a collection of blood from a blood vessel that wasn't bleeding at the end of surgery causes discomfort and swelling. In that case, if it's significant, you'd have to go back to the operating room to evacuate any blood, cauterize, seal off whatever's bleeding, and suture things up again. This happens again about 1 to 2 out of 100 cases. Infection is even less common. We give prophylactic antibiotics. We do it in a sterile environment. If you get an infection and it involves the space where the implant is, which is not very common at all, then the implant will have to be removed, the infection will have to be cleared up, and then you will have to replace your implant. Scarring, Generally, the skin incision is going to leave a scar. Generally, they're in areas where they're not very noticeable. As far as scarring in the pocket where the implant's placed, anytime you put anything inside the human body, whether it's a pacemaker battery pack, an artificial finger joint, a bullet, or a piece of glass, the body forms a thin white glistening membrane around whatever's put inside. In some situations, that membrane will thicken and tighten down. It's not going to affect a pacemaker or a piece of glass, but a breast implant that's supposed to feel soft, it makes it feel firm. So that is a possibility. The rate is probably below 5% in most procedures. Other problems that you can have are reflex pain problems, which are very limited. Usually pain and discomfort is gone within a few weeks after surgery. And then you may have some sensory sensations like burning, itching, tingling, lightning. Those may go on for 6 weeks to 3 months, gradually abating over time. And those are the primary problems that we see with breast augmentation.
Dr. Hart, you have given our viewers a lot of great information about breast augmentation. I'd like to thank you for being on this interview.
No, Mike, I really appreciate it, and thank you for your time.
Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking with Dr. William Hart of Hart Cosmetic and Reconstructive Surgery in St. Louis. If any of our viewers would like to get more information about breast augmentations from Dr. Hart, please refer to the phone number at the end of the interview. Again, Dr. Hart, thank you so much for this great information.
Well, I appreciate it, Mike, very much. Thank you.